We had a very interesting educational session on the role of molecular biology really in high-grade aggressive B-cell non-Hodgkin lymphomas, and my role was to give a more clinically focused discussion. And really what I concentrated on was how there are two main types of biology that we can utilise to potentially improve on R-CHOP in the frontline treatment of diffuse large B-cell lymphoma. One type of biology is targeting a ubiquitous marker, so a marker that's present on all B cells and therefore present on all or in all cases of B-cell lymphoma, including diffuse large B-cell lymphoma. And that's where most of the activity has been, and I'll come back to that in a minute. But the other type of biology is the sort of, I guess what most people mean when they talk about precision medicine. So they mean doing a mutation analysis, finding a target and adding in a key target. And in a sense, that's the straightforward one to sort of discuss, because actually we're not there yet in diffuse large B-cell lymphoma. There are great strides being made on the molecular classification of diffuse large B-cell lymphoma, moving beyond cell of origin to more of a mutational based classification system. But that's recently been defined, and so more work now needs to be done of identifying targets and incorporating them. Where we're really seeing a lot of research activity is this more ubiquitous target. So three targets are CD79B, which is the target of polatuzumab vedotin, the antibody drug conjugate, and the POLARIX trial now of R-CHOP versus POLAR-R-CHP has read out as positive. In other words, there's a progression-free survival advantage, but it's a fairly controversial trial because there's no overall survival advantage. So quite where we're going to see that positioned in different countries and regions around the world, remains to be seen. I personally think we probably will be able to have access in the UK, although obviously in England it needs to go through NICE, but it may be only available for a high-risk subgroup, but we'll see. That's my prediction. Another target is BTK, very well-known target in B-cell lymphoma, but much less well-developed in diffuse large B-cell lymphoma due to the Phoenix trial reading out a few years ago now and being a negative trial. So R-CHOP versus R-CHOP ibrutinib, no benefit. But actually when you looked in the younger patient cohort, there was quite a significant benefit of adding ibrutinib. But in older patients, there were more toxicities. They had reduced intensity of their chemo, and that's why there was no overall benefit. However, it's worth, I think, looking at new generation BTK inhibitors and using routine infectious prophylaxis. So we now have the ReModel-A trial open in the UK, which is our big sort of frontline diffuse large B-cell lymphoma trial, R-CHOP versus R-CHOP acalabrutinib. And I think that's a really important trial to address this question of will BTK inhibition improve on our results that we're seeing with R-CHOP chemotherapy. And then CD19 is another target, again, this time on the surface of B cells, and we've seen in previous meetings the Zuma 12 study, which is taking high-risk patients with diffuse large B-cell lymphoma or high-grade B with double-hit cytogenetics. And if they're interim PET positives, this is a true high-risk population. This is after 2 cycles of our chemo. They're taken off that treatment plan, given Axicell, that was the study, so CAR T-cell products, and very high overall response rates were seen with a PFS at the last data cutoff of around 75%, which compares very favorably with previous trials. So, that's where we're seeing the clinical activity at the moment. But I think one take-home message of the whole educational symposium is as we do these trials, we need to be collecting the biological material, because actually the mutational landscape, which I mentioned before, is almost certainly going to influence the results even from these ubiquitous targets. So, in POLARIX, the polatuzumab seemed to benefit the ABC subtype more than the GCB subtype. We're not quite sure if that's real yet, that has to be investigated further, but we need to be doing these underlying translational projects in our trials, and preferably in the real world setting as well.